Dear audience, dear chair, welcome to my complex exam. I would like to introduce you my PhD thesis, which is New Approaches in the Management of Oncological Patients. I am a hospital and clinical pharmacist and a second-year PhD student as well. My vision is that oncological patients could have a better quality of life. Therefore, my mission is to find the most effective treatment and appropriate management of side effects in oncological patients. Currently, I have two ongoing projects, which would be a systematic review and a meta-analysis. The first project is investigating the efficacy of preventive and therapeutic options for kinase inhibitory therapy-induced cutaneous adverse events. Over the past 2 decades, there has been a tremendous shift in cancer treatment. Oncology drugs approvals has increased, driven by targeted drugs, accounted for approximately 50%. Moreover, these drugs were in the top-selling cancer drugs in 2022. As you can see in the figure, kinase inhibitors have the highest number of approvals compared to other classes, so its use continues to rise. Unfortunately, they have the highest rate of serious adverse events as well, which is threaten the continuation of the original oncological therapy. The discontinuation of these cancer treatments occurs up to 76%. Interestingly enough, numerous prevention and treatment options exist, but there is still no consensus. So my aim is to find the most effective preventive and therapeutic options for kinase inhibitory therapy-induced skin toxicity. The clinical question is that what is the most effective preventive and therapeutic options for these cutaneous adverse events induced by kinase inhibitory oncological targeted therapy? I use a pie curve framework in which the population was patients who received targeted therapies. Intervention was prevention and treatment. The comparator was no prevention, no treatment, or placebo, and the outcome was efficacy and compliance to targeted therapy. Our hypothesis was that implementation of skin side effects prevention and treatment results in higher compliance to kinase inhibitory oncological targeted therapy. Here you can see my systematic search, the search key, and my flowchart of selection. Eventually, 61 eligible articles remained. The outcome was incidence of grade 1-4 and grade 3-4 cutaneous adverse events with the outcome measure of odds ratio. Before moving to the results, I briefly comment the heterogeneity of my topic. My articles investigated a wide variety of active ingredients and many types of cutaneous adverse events. So, in the first figure, we were analyzing the incidence of grade 1-4 cutaneous adverse events associated with preventive medication, summarizing RCTs. We separated systemic and topical interventions. For systemic interventions, the odds ratio was 0.7, which means that a patient had who received interventions approximately 30% lower odds for developing skin side effects compared to the control. For topical intervention, this value was 0.55, correspond to 45% of 45% decreasing of occurrence of side effects. The latter effect was statistically significant. In this figure, we were analyzing the incidence of grade 3-4 cutaneous adverse events, and for systemic interventions, the odds ratio was 0.24, and for topical interventions, this value was 0.74, similar to the earlier values. And in this case, the systemic interventions, the value of the systemic interventions was statistically significant. Moreover, we conducted a subgroup analysis, and we found that the pooled effect of systemic antibiotics was also statistically significant. I would like to emphasize the strengths. This was the first comprehensive meta-analysis with only randomized controlled trials included in the quantitative analysis. And it has a large patient population and wide range of investigated agents. As for limitations, I would emphasize that there were heterogeneous study designs, heterogeneous interventions, insufficient data for some outcomes, and underreporting of cutaneous adverse events. The main conclusion is that cutaneous adverse events can be decreased by preventive medications. And I would like to emphasize that systemic antibiotics are recommended for patients at high risk of developing grade 3 for cutaneous adverse events. And topical interventions, for example, URA, may be considered for all patients. And these interventions may improve quality of life and help avoid discontinuation of oncologic therapy. However, more RCTs with standardized methodology are needed, and it is necessary to develop evidence-based preventive and therapeutic strategies tailored to each type of cutaneous adverse event. Here you can see my progress of my first project. I submitted my paper a few days ago. And let me move on to the second topic, which is comparing the efficacy and safety of pharmacological therapies for advanced cutaneous squamous cell carcinoma. Cutaneous squamous cell carcinoma is the second most common non-melanoma skin cancer. Its incidence is 1.8 million per year, which is predicted to increase by 50% by 2030. The current therapies are chemotherapy, targeted therapy, and immunotherapy. And our aim is to find the most effective and tolerable therapeutic option for cutaneous squamous cell carcinoma. Our clinical question is, what is the safest and most effective treatment for advanced cutaneous squamous cell carcinoma, using the PICO framework as well, in which the population is patients who have advanced cutaneous squamous cell carcinoma. The intervention would be immunotherapy, the comparator would be chemotherapy and targeted therapy, and the outcome would be survival, recurrence rate, and adverse events. Our hypothesis is that immunotherapy is superior to chemotherapy and targeted therapy in the treatment of advanced cutaneous squamous cell carcinoma. Our clinical and research implication would be the early use of immunotherapeutic agents can improve patient survival. This topic is under construction. And as a summary, I would mention that there are two projects which is currently ongoing, or my first project submitted. And thank you for your attention. With the words of Eleanor Roosevelt, you must do the things you think you cannot do.
Thanks for the nice presentation. My first question is for the second part, what is the standard therapy of advanced squamous cell carcinoma now in Hungary?
In Hungary. I'm not sure.
Of course, after the surgical treatment.
Yeah, I'm not sure because I'm not a professional, but I think maybe it's chemotherapy. I'm not sure.
Immune therapy.
Immune therapy?
Mm-hmm.
Yeah.
In which immune therapy?
Cemiplimab.
Yes,
yeah.
Cemiplimab.
It's cemiplimab.
Okay. Do you know side effects of PD-1 inhibitors? What can be the main side effect?
Maybe it affected to the skin as well.
Yes, of course.
I'm not sure.
Okay, and the other part, you mentioned that systemic antibiotics are effective for skin adverse reactions.
Yes.
And which antibiotics do you mean?
Tetracyclines.
Tetracyclines.
Yeah.
Okay.
We investigated the tetracyclines group because the articles investigated it, and it contains doxycycline, limacycline, minocycline, and tetracycline as well. Yeah.
Okay. Thanks.
Thank you.
Just congratulations.
Thank you.
Sorry to ask some medical questions also. You know, I know you are a pharmacist, but regarding the side effects, perhaps you are professional also. So if we give systemic antibiotics, so antimicrobial therapy, then is it good for the skin? But can lead to other side effects. Do you know what are the side effects? Dysbacteriosis, Clostridium, diarrhea, what about? So what is the situation in this patient population? Are there any side effects? So we give something for side effects, but this can lead to other side effects. You understand what I mean? So if we give for a prolonged period of time antibiotics, that can be harmful also. So what is the situation in this patient population?
Thank you for your question. We didn't investigate this approach of this topic, but definitely tetracyclines have side effects. For example, gastrointestinal side effects, and those side effects as you mentioned, and because of this condition we suggest short-term usage, and I would emphasize the photosensibility as well of this agent.
And do you know, perhaps, very, very careful, I asked very, very careful, why we don't use it in pediatrics generally? Do you know it? In pediatrics, we don't use it or very seldom. Do you know the why?
Yeah, because it affects the bone and the teeth growth as well.
The growth development and bone development. And
yeah, I didn't investigate children population, only adults.
Sure. You didn't see too much studies for pediatrics with tetracyclines also. So okay, in some situation we give, but only for a short period of time, if it possible. Yeah.
Thank you.
On your first study, you mentioned that the conclusions that antibiotics should be given to high-risk patients, like as a prevention. Who would you consider a high-risk patient here?
Yeah, it is a suggestion for us. It must or have to be investigated, perhaps another project, that what is this population we can determine a high-risk population.
What do you think, like, who would be eligible to called high risk?
Maybe I think patients with poor general condition as well, because these skin side effects could hardly affect quality of life, and as I mentioned, patients can easily interrupt their therapy, and it affects the adherence as well.
Congratulations. Very briefly, does it make any sense to combine this preventive therapy? Is there any data on that? Can it be more efficient, or theoretically, can there be like a synergy between these strategies, and in which patients maybe?
Yes, thank you for a question. As I mentioned earlier, my study is very heterogeneous, with heterogeneous methodology. So I mean that in these studies, unfortunately, patients received not only one intervention. So it was very hard to pool these few data as well. And so as you can see, 9 studies were in the quantitative analysis because of this fact as well. And the other almost 50 articles must have to assess in the qualitative analysis because the patients not only receive topical, or if they receive topical, generally received tetracyclines as well, preventively, or if articles investigated reactive treatment, generally, unfortunately, receive the patients preventively tetracycline as well. So it's very hard, and we saw that generally in this condition more interventions are used. Yeah.
Just one more question. Do you know, perhaps your topic was the kinase inhibitors, side effects, skin mostly, but what other side effects can have the kinase inhibitors therapies, the different types? There are a lot. Do you know something about it instead of the skin? What other side effects can occur?
Thank you for a question. There
are a lot of others. Not only the skin problem is the problem.
Yes, it depends on the type of the kinase inhibitors. For example, the IGFR inhibitors, the IGFR receptors can be found in the skin as also the mucosa, so it can cause mucositis as well. Or there is a kinase inhibitor, for example, VEGF inhibitors, and this receptor this mechanism is in connection with vascular
okay.
Sorry.
There are really a lot of kinase, tyrosine kinase, and other kinase inhibitors, and different groups have different, even severe side effects. So even we have to stop the treatment, not only for the skin alteration, but for example, severe gastrointestinal alteration, bloody diarrhea, and neurologic symptom, ataxic movements, or very strange behaviors, and so on. So really, these new types of treatments have side effects also, not only the skin. So you have to be cautious, and not all patient tolerate, unfortunately.
Yes, thank you.
Congratulations for your nice presentation. I have two questions regarding for your first topic. First of all, how was the adverse events classified, and which were the most frequent cutaneous adverse events?
Thank you for your question. The side effects were classified according to so-called CTCAE tool. This name is whole name is common terminology criteria for adverse events, and this is a standardized grading tool system to determine in each side effect each grade or the severity. And for the second question, the most frequent side effect, as we can see the articles, was acneiform rash.
Thank you.
Thank you.
I have one general question, maybe not directly related to your topic. You showed a picture of advanced squamous skin cancer. I was just wondering, every time I see an advanced cancer like this, why do you think the patient don't come earlier? When it's in such a visible place, they can see it earlier and much earlier when it's still small or in very early stage. Why do you think they wait until it becomes this aggressive? I don't know, have you thought about any reasons, like what kind of?
Thank you for a question. It's very, very hard question.
I know I'm not expecting like a true answer. I was just wondering, and the picture you used, it just brought back many questions in my head again. Every time I see not only the skin cancer, but many other cancers as well. But do you have any thoughts or any thoughts why the patients wouldn't come earlier? Any factors?
Yeah, I think they are older people, older patients, and I think simply don't want to go to the doctor. But it is my personal opinion. It is hard to go to the doctor for these patients, I think.
I was also shocked by a number. Can we go to the second project, please? So in the introduction, you mentioned that 1.8 million new cases per year. That seems to be an immense number, even for United States, which is 340 million people. What is the situation in Hungary, if you have any knowledge of comparable numbers in our country?
Currently I haven't got any information about the Hungarian situation. And
how about the survival rates? Is it like well treatable? I mean, I'm absolutely not knowledgeable with this disease, so how are the survival? I guess this is an extreme case, but still, what is it? It's like a very good survival, or it's mostly treatable, or patients pass away quickly?
I'm sorry, I haven't.
Okay. It was just shocking to me. It's a lot. Okay, but anyways, thank you, and I think very interesting project.
Thank you for your question.